All right, let's now cross to Geneva in Switzerland, where the World Health Organization briefing is currently in progress. We see the Managing Director, Dr. Tedros Ghebreyesus Adhanom, giving that update. Let's cross over there right now.
Against a virus that was completely unknown to us only a year ago is an astounding scientific achievement. But an ever greater achievement would be to ensure all countries enjoy the benefits of science equitably. WHO and our partners are focusing on three priorities. First, we face an immediate funding gap of $4.3 billion to procure vaccines for the most needy countries. I urge donors to fill this gap quickly so that vaccines can be secured, lives can be saved, and a truly global economic recovery is accelerated. Second, we have worked hard to secure political commitment from world leaders for equitable access to vaccines, but we would like to see that commitment being translated into action. And third, we're preparing countries to deliver vaccines by assessing gaps in infrastructure. Already, almost 1 billion doses of 3 vaccine candidates have been secured as part of the COVAX facility, and 189 countries are now participating. Our COVAX partner, Gavi, is in discussions with several other manufacturers, and further deals will be announced in the near future. Simultaneously, WHO is working with Gavi and UNICEF to evaluate the first set of requests received from countries who are eligible for assistance through the COVAX facility. Addressing the financing gap is an urgent priority. On Monday, WHO and the European Commission are reconvening the Facilitation Council for the ACT Accelerator with our co-chairs, Norway and South Africa. The Council will scrutinize our strategic priorities and a draft financing framework to close the ACT Accelerator financing gap for 2021. This is crucial to ensuring all people everywhere are protected. We have all seen images of people being vaccinated against COVID-19. We want to see the same images all over the world. And that will be a true sign of solidarity. Yesterday was Human Rights Day, and tomorrow is Universal Health Coverage Day. These 2 days coming so close together at the end of this very difficult year are a reminder that as we rebuild from this crisis, we must do so on the foundation of human rights, including the rights to health. 2020 has reminded us that health is the most precious commodity on earth. In the face of the pandemic, many countries have offered free testing and treatment for COVID-19 and promised free vaccination for their populations. They have recognized that the ability to pay should not be the difference between sickness and health, between life and death. This year, Universal Health Coverage Day takes on even more importance than usual. Apart from the death and disease caused by the virus itself, millions of people have suffered and died as a result of disruption to essential health services. This week, WHO is launching 2 initiatives to support and rapidly accelerate countries' journey towards universal health coverage. The first is a global program to strengthen primary health care, better equipping countries to prevent and respond to emergencies of all kinds, from the personal crisis of a heart attack to an outbreak of a new and deadly virus. The second is a new UHC compendium designed to help countries develop the packages of services they need to meet their people's health needs. WHO is also launching a new report that provides the first analysis of how global health spending has changed during 2020 in response to the COVID-19 pandemic. Many governments have responded to the pandemic with exceptional budget allocations for their health systems, and even larger allocations for economic stabilization and social protection. At the same time, COVID-19 has triggered a deep global economic crisis that could have a long-lasting impact on health financing. Public revenues are declining, forcing many countries to take on additional debt, which will impact lower-income countries whose economies were vulnerable before COVID-19 struck. The report warns that higher debt servicing could make it more difficult to maintain public spending on health. But this is precisely the moment for investing in health. The pandemic has demonstrated that health is not a luxury. It is the foundation of social, economic, and political stability. Indeed, today's report highlights that the COVID-19 crisis provides an opportunity for a reset in countries with weak health financing systems. It makes 6 key recommendations for a new health financing compact. To draw more attention to universal health coverage, we have also made it one of the main categories in the second WHO Health for All Film Festival. We're inviting all filmmakers, whether professional or amateur, to submit short films focusing on access to quality care for any health need by the 30th of January 2021. Several hundred films have already been submitted, and the 2 other categories for the festival are health emergencies, in which we invite short films about COVID and other humanitarian crises, and better health and well-being, in which we invite films about climate change, pollution, sanitation, nutrition, gender issues, and more. We know that although children are less at risk of severe disease and deaths from COVID-19 than older adults, millions of children have suffered from the pandemic in other ways, including disruption to their education. According to data collected by UNESCO, classrooms for nearly 1 in 5 school children globally, or 320 million, were closed as of the 1st December, an increase of nearly 90 million in just 1 month. In some places, children have been out of school for 9 months or more. Prolonged school closure are presenting an unprecedented challenge to children's education, health, and well-being. Today, WHO has released a new checklist to support schools in reopening and in preparing for resurgences of COVID-19 and similar public health crises. It lists 38 essential actions, a new checklist to support schools in reopening and in preparing for resurgence of COVID-19 and similar public health crises. It lists 38 essential actions to be considered by different stakeholders as they work together to agree school reopening plans. More than 66 million cases of COVID-19 and 1.5 million deaths have now been reported to WHO. In the past 6 weeks, the number of weekly deaths has increased by around 60%. Most cases and deaths are in Europe and the Americas. The festive season is a time to relax and to celebrate, but we must not relax our guard. Celebration can very quickly turn to sadness if we fail to take the right precautions. As you prepare to celebrate over the coming weeks, please consider your plans carefully. If you live in an area with high transmission, please take every precaution to keep yourselves and others safe. That could be the best gift you could give. The gift of health, life, love, joy, and hope. I repeat, the gift this season, the best gift this season you could give is the gift of health, life, love, joy, and hope. I thank you. Happy holidays.
Thank you, Dr. Tedros. I will now open the floor to questions from members of the media. I remind you that you need to raise your hand, use the raise your hand icon in order to get in the queue to ask your question. I think we will start with Laurent Sierot from ATS, Swiss News Agency. Laurent, can you hear me?
Yes, thank you, Fadela. Can you hear me?
Very well. Go ahead, please, Laurent.
Yeah, very good. We have observed in the recent weeks a trend downwards in countries like Switzerland and some of its neighboring countries. But then more recently, since 1 week, there is a kind of plateau at high-level number of cases, despite strong measures that have been taken by the different governments. So how do you explain that? Thank you.
Thank you, Laurent. I would like to invite Dr. Van Kerkhove to take this question.
So thank you for the question. Indeed, across many countries in Europe, we have started to see a decline in cases. And there have been, and I think that's a result because of the measures that have been put in place and individuals who are adhering to those measures. But as you said, it's starting to plateau in some locations. And what this means is that we need to stay the course. We need to follow through. We need to continue to practice the physical distancing, staying home if being asked, teleworking, following all the measures that are put in place to keep ourselves safe. Whether these are individual level measures such as physical distancing, the wearing of masks, cleaning your hands, practicing good respiratory etiquette, whether you are asked to stay at home, continue to stay at home. But we have to follow through. I think one of the lessons we can learn, especially across Europe, is over the summer, Europe showed us that they brought transmission under control. In many countries, cases were down to single digits, and that can and that will be done again. But we really must be vigilant, and we really must stay the course. Given the holidays that are coming up, as the Director General just said, it is a time when many people want to come together, but we really need to make very careful decisions about how we celebrate this year. We will celebrate, but maybe it means we celebrate with just our household, and maybe we do another type of Zoom celebration, as we will do with my family this year. But we do need to stay strong, and we do need to make sure that we keep ourselves separated from others for the time being, while we have the good news of vaccines coming online. But again, just to repeat, we need to stay the course. It's very easy for us to go up quickly in case incidents. It takes quite some time to actually come down the other side of the mountain that you've heard Mike say in the spring. So we have to follow through. But we will do it. Europe will do this again, and they will show us how to bring it under control.
I think, Maria, you're absolutely spot on. I'll just repeat two of your words. Follow through. Make sure this time that we follow through on the measures. We continue to build public health surveillance. We continue to work with communities to maintain those measures around physical distance, personal hygiene, avoiding crowds, and then we add vaccines gradually in the coming year. We can avoid the lockdowns. So this is about us all following through on our commitments, both as individuals, as communities, and as governments in the coming months.
Thank you. I would like now to call on Jason Beaubien from NPR to ask the next question. Jason, are you with us?
Yes, thank you very much. As you mentioned, Dr. Tedros, that the UK has now started vaccinating, and the US appears to be on the verge of authorizing the Pfizer vaccine. And you talked about the need for equitable distribution, but obviously that distribution can't start in many places until the WHO authorizes a vaccine. Can you give us an update on when we can expect the WHO to authorize a vaccine that can start being distributed through COVAX?
Thank you, Jason. We have with us remotely Dr. O'Brien and Dr. Soumya Swaminathan. Kate, do you want to start? Or Dr. Swaminathan?
I don't think Kate is connected.
Okay, Dr. Swaminathan, you have the floor.
Thank you. Thank you, Fadela. Yes, I can start. So the WHO has put out our criteria for emergency use licensing, and we are open to receiving submissions from all manufacturers who are interested. In fact, we've received several, and it's a rolling submission. So as more data is accumulated from the different phases of trials, it's provided to WHO so that we're up to date and we can stay as updated as possible. And we are now going to be looking at the Pfizer dossier, followed by a couple of others as they come in. And we expect that we work very closely with the European Medicine Agency, along with some of the other national regulatory agencies. And so we expect that in the next couple of weeks that our committees will be reviewing the Pfizer-BioNTech dossier and coming out with an opinion. Thank you.
Thank you. I think Dr. Aylward would like to add something.
Yeah, thanks so much. And Jason, thanks for the question. Super important. When we established the COVAX facility to make sure that there would be absolutely no barriers to the most rapid access to vaccines possible for all countries in the world, we're actually using a slightly different process wherein we are indeed looking at these products through the WHO emergency use listing procedure. And at the same time, we have an exceptional procedure in place where some products that are approved by what we call a stringent regulatory authority can also be considered by the COVAX facility. So there will be no barrier to the speed with which these products could potentially be used globally.
Thank you. I would like now to call on Isabel Sacco from EFE, the Spanish news agency. Isabel, you have the floor. Isabel?
Yes, good afternoon. Yes, I had this more or less the same question as the previous one. I would like maybe to ask again on if Dr. Soumya can identify the vaccines, the candidates that WHO is reviewing, and if for the general public, if she can explain the importance of this review by WHO, taking into account that we all know that there are many other regulatory national agencies that are doing the same procedure. Thank you.
Thank you, Isabel. Dr. Swaminathan?
Yes, thank you for that question. Indeed, it's a bit confusing because, as you rightly pointed out, national regulatory authorities do have the mandate and the jurisdiction to make these assessments and decisions for use within their own countries. So every national regulatory authority has the authority and the mandate to do that, but that's limited to their own countries. Now, several countries rely on WHO's pre-qualification service for vaccines and for drugs. And that's a service that WHO provides also for global procurement agencies like UNICEF and Gavi, because it's a stamp of quality, safety, efficacy, and manufacturing quality. In the case of the emergency use license, of course, we base this assessment on limited amounts of data, and that's clearly laid out in the criteria. So what should be the minimum efficacy, what's the minimum safety required data that's needed, as well as, of course, all the manufacturing details around the quality of the product. So as I mentioned, we had opened the expressions of interest several weeks ago. I think it was about 4 to 6 weeks ago, and we have been receiving both inquiries as well as submissions of dossiers from several companies. At least 10 companies have either expressed an interest or submitted initial dossiers. Now, the data will only be considered for an emergency use license when there is some phase 3 clinical trial results available. And so there are only a couple of companies now that have those phase 3 results, and those are interim results. And so we've started with the Pfizer dossier. We expect also to have the Moderna, followed by the AstraZeneca dossiers examined in the next few weeks. And we will be coming out with the decision whether it is receiving an emergency use license or not. The other thing that we are doing is, of course, working with the regulatory agencies, the International Coalition for Medical Regulatory Agencies, the ICMRA, with whom we have a letter of agreement now on how we would work together so that we can speed up things further. We have regulators from several countries, actually, who have stepped up and volunteered to help the assessments that WHO will be performing. So these will be joint assessments done with national regulatory agencies. And we have asked countries also to prepare for licensing of vaccines by either accepting the WHO EUL or PQ procedures or by accepting one of the stringent regulatory authorities, as Bruce was just mentioning, so that they are in a position to receive vaccine doses from the COVAX facility. They have to accept either of these. What we don't want is for every country to start an assessment process for every vaccine, because that's just going to take far too long. And so therefore it is important to rely on a few regulatory agencies globally plus the WHO process. Thank you.
Thank you, Dr. Swaminathan. Dr. Atkili would like to add something?
Yeah, thanks, Vela. And just to complement the points made by Soumya on this, one of the pieces of work certainly is getting the vaccine through the regulatory process and getting it reviewed here at WHO. But as we've always said, it's not vaccines, but vaccinations and vaccination programs that will end up protecting people. And there's tons of work going on right now. In fact, the entire ACT Accelerator in many ways, as the person doing a lot of the work on the Health Systems Connector, has pivoted to support the assessment in countries. We were targeting 100 countries. We've now got 105 assessments already in, and the picture of what is going on and how countries are preparing, not just on regulatory work, which does need some more work on, but also on safety monitoring systems. We've got over 65% of countries that have already got safety monitoring systems in place. So all of that work will be as important as the work that Soumya just mentioned.
Thank you. I would like now to invite Jeremy Lange from Radio France Internationale, RFI, to ask the next question. Jeremy, do you hear me?
Yes, I can hear you, Fadela. Thank you so much. A question about testing. A lot of people are thinking about getting tested ahead of Christmas. In France, the health minister advised against it, saying that it might provide a false feeling of safety. I would like to know, what is WHO, do you have any comment on that? Do you advise against or for testing before Christmas? Thank you.
We certainly advise that all patients who are suspected of having COVID-19 are tested, and that we expand testing, particularly the use of rapid diagnostic tests in specific circumstances. Maria can go into details about how we see the strategic expansion of testing, but we need more testing, not less. I think the Minister may have been relating to the specific issue of individual risk. Finding as many infected people in the community is very important, but when you get a test and you test positive or negative on a certain day, it doesn't mean you will test negative the next day or the next day. So doing more testing to find infected people, yes, good. Relying on a single test to guide your behaviour in the coming days, or who you can meet or what you can do, is problematic because knowing your status today does not guarantee your status tomorrow. So we must sustain the behaviours of physical distancing, wearing masks, avoiding crowded spaces, ensuring we're using appropriate ventilation, and doing all those things to minimise risk in those environments. That does not mean that targeted strategic testing is not a good idea. We want to see an expansion of testing, but we want to see it done for public health purposes. Individuals who have the resources to have themselves tested, there is nothing wrong with getting a test. It's really how you interpret that result and how that affects your behaviour and how it should or shouldn't affect your behaviour. Maria?
Yeah, thanks. Just to supplement what Mike has said, we encourage, we advise, we recommend strategic testing. We have since the beginning. And anyone who meets the suspected case definition should be tested. We've worked very hard through our regional offices and our country offices to build testing capacity. This has been a PCR-based testing capacity, and now all countries are able to test for COVID-19, test for SARS-CoV-2 infection, the virus that causes COVID-19. And that is really quite an incredible feat. We now have antigen-based rapid diagnostic tests that are coming online. These are cheaper, quicker, easier to use. And we recommend these to be used in areas where there's a lot of virus, circulating, where there are outbreaks that are happening, in areas potentially screening individuals like health workers who are at a higher risk of exposure because they have direct contact with known patients. And those are really helpful to alleviate some of the pressure on the PCR-based system. But testing for testing's sake must be linked to public health action. It must be linked to isolation of cases, clinical care of cases, contact tracing, supported quarantine of those contacts. And as Mike has said, a test result gives you the result of that sample that was collected at the time of testing. You could become infected between the time that you took that test and the time you get that result back, which is why it's really important that you not only get tested with a high quality either PCR test or an antigen-based test, but that you get that result back quickly. And you follow through with the public health actions that are there. So in some countries, testing will be expanded, and this is good, and we have seen a global expansion of testing. But again, it needs to be fit for purpose. It needs to be linked to cluster investigations and case finding and making sure that you're working towards your goal of reducing transmission and you're breaking chains of transmission. So there are good products that are coming online. These rapid antigen-based tests are a game changer in many ways because they can be used in lots of different settings and take the pressure off of the PCR systems. But again, we still, all of us, need to adhere to all of the measures that keep ourselves safe and keep our loved ones safe. So keep up that physical distancing, keep following all of the measures that are put in place in the local area where you live, which is based on the transmission that's happening around you.
Thank you. Moving now to Cancun in Mexico, I would like to invite Paulina Alcazar from Cadena News to ask the next question. Paulina, do you hear me?
Sí, Fadela, gracias. ¿Me escuchas?
Go ahead. Yes, go ahead, please.
Gracias. Buenos días. Aquí desde Cancún les saludamos. ¿Qué consideraciones se deben tomar ahora con un número elevado de reinfecciones? ¿O se considera esto como un COVID largo o COVID persistente cuando una persona vuelve a dar positivo en sus pruebas después de varios meses? Gracias.
Yeah.
So thanks for the question. There's two aspects to the question that you've asked. One is about reinfection, and then I think the other one is about long COVID. So these are two separate things, and let me just break them down very briefly. So we do know that there are some individuals who can be reinfected with this virus, and this is being detected in a number of countries that have good lab systems that have been able to do a sequence of the first infection and a sequence of the subsequent infection, the second infection, and they can tell that there's a difference in that virus, a slight difference because the virus changes, and that is indeed a subsequent infection. We don't have this this is now starting to be picked up in a number of countries, and we have more than 69 million cases that have been reported globally, but the number of reinfections is a lot smaller than that. We're working with countries to help them better define what a reinfection is and to help them look to see how often this is happening. So it doesn't seem to be happening very often, but we can't quantify that at the current moment. The question around long COVID is that there are individuals who have been infected with the SARS-CoV-2 virus. They have an acute disease where they're very unwell or they're mildly unwell, and then they seem to slightly recover, but they're having longer-term effects. We are learning more and more about what long COVID is in terms of the effect on the body. It seems to affect many different organ systems. It's not just a respiratory illness of 2 weeks. It seems to persist for months. We're working with many different patient groups. We're working with many different researchers to really better understand what is happening. We have met, and the Director General has met with patient groups, and the patient groups have said to us what they need is recognition that this is real, and this is real. And there is now an ICD code for post-COVID syndrome, it's called. We're working with them because we need better research to understand the extent of this in different populations, to understand what disease looks like in terms of the long-term effects and the different effects on the organ systems, and also rehab. So we're working with clinicians to better design and work on rehabilitation for individuals who are suffering from this to ensure that we give them the best care possible. So we have a lot to learn in this area. There was a forum that was organized this week by ISARC and partners, which WHO participated in, and we have seminars and working groups that have been established specifically to look at this so that we can provide adequate care.
And if I could just...
The World Health Organization delivering a media briefing there to media houses internationally. And as the world, as we've seen in the past few days, is experiencing a second wave, and South Africa included are experiencing a second wave. That media briefing was coming out of the WHO head office in Switzerland. This is The Full View on SABC.